How do mucus thinners help sticky CF mucus? Imagine trying to clear a thick, sticky substance from your lungs that just won't budge. That's what many people with cystic fibrosis experience because of the abnormal mucus buildup. This mucus becomes very thick and sticky because of a problem with a protein called CFTR. When CFTR doesn't work properly, less water gets into the airway secretions, making the mucus dense and hard to clear. Mucus thinners are medicines that help make this mucus less sticky and easier to cough out. They do this in a couple of important ways. One common mucus thinner is called dornase alfa, also known as Pulmozyme. It is an enzyme that targets and cuts up DNA that gets into the mucus from immune cells called neutrophils. During infections or inflammation, these cells releases DNA, which makes the mucus even thicker and more elastic. By breaking down this DNA, dornase alfa reduces the mucus's stickiness and viscosity, helping it become more fluid. This makes it easier for patients to clear their lungs through coughing or airway clearance techniques. Clinical studies have shown that using dornase alfa can decrease lung exacerbations and improve breathing over time. Another widely used mucus thinner is hypertonic saline, which is a salty solution inhaled into the lungs. The high salt concentration pulls water from the surrounding tissues into the airway surface liquid through a process called osmosis. This extra water hydrates the mucus, making it thinner and less sticky. When mucus is more hydrated, it is easier to move and clear from the lungs, reducing blockages and improving breathing. Hypertonic saline is often used alongside other therapies to boost mucus clearance, especially in people who have difficulty clearing mucus on their own. There are other agents like N-acetylcysteine, but evidence supporting their use in cystic fibrosis is limited. Researchers are also exploring new drugs that target other components of mucus, aiming to improve clearance without compromising the mucus's natural protective properties. In practice, mucus thinners are usually combined with airway clearance techniques such as chest physiotherapy, mechanical devices, or breathing exercises. These combined approaches help remove mucus more effectively, reducing the risk of lung infections and damage. It's important to note that mucus thinners are part of a comprehensive treatment plan and should always be used under medical supervision. Recent research is investigating whether some patients might be able to reduce or stop using mucus thinners as newer cystic fibrosis treatments, like CFTR modulators, improve lung function and mucus properties. However, any changes to medication should always be discussed with a healthcare professional to ensure safety and effectiveness. In summary, mucus thinners work by either breaking down the sticky components in mucus or adding water to hydrate it. This makes the mucus less thick and easier to clear from the lungs, helping improve breathing and reduce lung complications. Always consult with your healthcare team to find the best approach for managing mucus in cystic fibrosis.